Good evening, everyone. We warmly welcome you all to the special occasion of celebrating the International Day of Yoga, a day dedicated to promoting the physical, mental, and spiritual well-being through the ancient practice of yoga. Let us begin this program with positivity and enthusiasm and make this day a meaningful step towards a healthier lifestyle. International Yoga Day is celebrated every year on 21st June. Yoga originated in India thousands of years ago and is a holistic practice that connects body, mind and breath. The theme of 2026 Yoga Day is Yoga for Healthy Aging. The idea is to focus not only on living longer but also on living healthier. Yoga is seen as a simple, accessible way for people of all ages, especially older adults, to maintain good, healthier and quality of life. Sri Lakshmi will tell about introduction and the benefits of yoga. Sandra will tell on the physical health and mobility. Linchu will tell on the mental health and cognitive. Sharanya on holistic care. Tansha about therapeutic yoga application. Ashwini and team will show the demonstration related to the stress relieving activities. Questioning session will be conducted by Krisha. Conclusion will be dealt by Darshaya. And MOC will be
introduction of yoga. Yoga is an ancient practice that combines with physical exercise, breathing techniques and meditation. It helps improve the health and reduce stress and combine with both and create balance between the body and mind. Yoga promotes overall well-being and peaceful lifestyle. Yoga is not just an exercise that encourages the physical fitness, mental health and inner growth. Father of yoga generally considers Patanjali. Yoga is one of the key systems included under AYUSH and widely practiced for preventive and promotive health care. Celebrate every year on 21st June to raise awareness about many benefits of yoga for physical, mental and spiritual health. Healthy aging is the process of maintaining good physical, mental and social well-being as people grow older. Benefits of yoga: improve flexibility, reduce stress and anxiety, enhance emotional stability, improve quality of life, reduce body pain, improve concentration and memory, help in weight management, improve in overall immunity.
My dear fellow nursing students, I am Sandra Joseph. I am assigned to explain on the topic physical health and mobility. First of all, I have to tell you something. Yoga is a combination of physical and mental exercise. An important thing we all have to remember is that yoga is not a cure to any disease. It is a prevention. So practicing yoga in early life helps to be free from many physical problems in later age. So when we think of aging, the first image that comes to our mind is grey hair, wrinkles and medicines. But as nurses, we should know that the real challenge of aging is not appearance, it is the loss of function. So if we want to be healthy in our older age, we should be practicing yoga from now. Now the question is, can we slow this decline without using drugs or other treatments? This is where yoga becomes relevant for us as nurses. It works on the exact force system that aging affects first, that is muscles, joints and breath. Instead of treating each problem separately, yoga addresses them together. So in the next few minutes, let us know how yoga helps in physical health and mobility. Mobility means the ability to move freely, safely and without pain. Physical health means having enough muscle strength, joint flexibility, balance and energy to do daily activities. With age, these four things decline naturally due to muscle loss, joint stiffness, poor balance and reduced lung capacity. The benefits of yoga in physical health are muscle strength, nerve health, lung health and joint health. Muscle strength, yoga uses body weight and isometric pose. This helps in slowing sarcopenia, which is the age-related muscle loss. Better muscle strength also improves bone density, because muscle pain stimulates more. So yoga protects us against both muscle wasting and osteoporosis. Nerve health. Yoga helps to train a person's proprioception and vestibular system by improving balance, coordination, etc. Lung health. Physical health is not only muscles. Poor breathing is equal to poor oxygenation, which is equal to fatigue. Pranayama like Nadi Shodhana and diaphragmatic breathing improves lung capacity. Joint health, slow controlled stretches in yoga increases synovial fluid in joints. Think of it as oil for hinge. Without this, cartilage dries and joint capsule tightens, which leads to stiffness, pain, and osteoarthritis.
Wishing you all an International Happy Yoga Day. Today I'm going to talk about the topic Yoga for Mental and Cognitive Health. So before starting our session, let me ask you a question. How many of you have felt very really tired after completing your clinical course? Can you raise your hands? Yes. Yeah, most of us feel very tired after completing our clinical course. So that's why we are talking today the importance of yoga in maintaining our mental and cognitive health. First, we can see how yoga helps in maintaining our mental and cognitive health. The reality of nursing. Nowadays, the nurses faces really stressful shifts during our requirements. So, the studies from Harvard University shows that 40% of nurses are facing burnout symptoms. Burnout symptoms has been recognized by WHO as occupational phenomenon. Night shift mess up our sleep, sport blues mess up our nervous system. So yoga plays a vital role in reducing the burnout symptoms. So today I will introduce a 5 minutes yoga kit which helps you relax your muscles and reduces your stress level to an extent. Let's see how does yoga change your brain. Mainly through three mechanisms. The first one is cortisol. The cortisol decreases by practicing yoga. Cortisol is the main stress hormone in our body. So practicing yoga helps to reduce the cortisol level, which reduces our stress. Next one is GABA. GABA is the anti-anxiety chemical which is in our body. So the decrease in GABA results in anxiety disorders. So practicing yoga every day helps you to reduce the anxiety level by increasing GABA. Control your breath for counting 4. Next, you have to expel the breath by counting 4 and you have to pause it for 4. You have to practice every day this for at least 2 minutes. It will improve your breathing capacity, also relax your mind and improves focus. Next one is legs up curl. This yoga is very much important for the nurses because we stand for a long time. That makes our legs very tired and painful. So by practicing this legs up curl, it helps you reduce the pain and drains out the blood very fastly. Next one is Anulom Vilom. It is also called alternate nostril breathing. This yoga is practiced to improve our focus and maintain our breathing. So you have to keep your finger in one nose, take breathing in another nose and expel out through other nose. This have to be continued for 2 to 5 minutes. So it helps to improve your focus. So we are coming to an end of our session. You care for patients. So yoga helps to care for you. A calm focused nurse is equal to safer patients plus longer career. Thank you and wishing you a happy yoga day.
Good evening, everyone. I'm standing here to take a seminar about the holistic yoga. Before we talk, let's test this. Sit however you're sitting. Don't change anything. Close your eyes. Notice 3 things. There is tension sitting in your body right now. And second one, is your breath is your body, chest or belly. How many taps are in your mind? These are the 3 things. And then take 3 deep breathable, free. Then exhale. While you are doing this exercise, your shoulder will drop that time. That the 1 minute, your body and the mind and the brain, these all together to form, to give you these are the holistic yoga. Means if you doing this exercise, your mind, the body, and the brain is whole together. We call as holistic yoga. First, we see the meaning of holistic yoga. Holistic refers to addressing which person, including the physical, mental, and the emotional health, while taking the these three factors that include also the social factors. This could be specific to diagnosis, in which case of holistic approach might be considers all symptoms, the holistic treatment which may be very effective and empower the patient to take charge of their own care. The holistic yogas involve three main dynamics which are physical, mental, and the emotional.
Now let us enter to our topic. My topic is therapeutic yoga application in nursing. Therapeutic yoga increasing use in nursing care to support patient physical, mental, and emotional well-being, which combines gently physical yoga postures, breathing exercise, relaxation technique, and meditation to aid healing and improve the quality of life. Next, definition of therapeutic yoga. According to the International Association Yoga Therapists, yoga therapy is the professional application of yoga principles and practice to promote health and well-being within the therapeutic relationship. It is called apply the yoga in nursing. Next, we see about the components of therapeutic yoga. First one is asana. It is called yoga postures. Improves strength, flexibility and balance. Examine tadasanas, then pranayamas. It is also called breathing exercise. Enhance the lung function. Lung function, reduce and stress and anxiety. Then meditation improves concentration and emotional stability. Promotes relaxation. Then relaxation techniques, deep relaxation and mindfulness, reduce fatigue and tension. Next we see about the areas where apply the therapeutic yoga in nursing. The first one is the stress management. How yoga reduce the stress, promote the relaxation and mental calmness, helps reduce stress, anxiety and the emotion tension. Next one is the pain management. How reduce pain means improve flexibility and muscle relaxation, can help patient cope with the chronic pain conditions such as asthma, arthritis and headaches. Yoga helps to improve the flexibility and muscle relaxation to reduce the pain. Then next one is the cardiovascular health. Cardiovascular health assists in lowering blood pressure and improving the circulation, support patient recovery from the heart related condition. Using yoga to improve the circulation and blood pressure, so it reduces the it improves the cardiovascular health. Then next one is the improved respiratory function. Breathing exercise enhances the lung capacity and oxygenation, beneficiary for patient with the respiratory disorders. If a patient has any respiratory disorders, using yoga breathing exercise, mainly breathing exercise, enhances the lung capacity and oxygenation. Then next one is the sleep improvement. helps reduce insomnia and improves sleep.
Form the Nasika Mudra. Gently rest your right thumb on the right nostril. Inhale through the left nostril. Close the left nostril and exhale completely through the right nostril. Have to practice it for 2 to 5 minutes a day. Relax. Now the next yoga pose is Tadasana. This is most commonly known as the mountain pose. This is a foundation standing posture in yoga. The name comes from the Sanskrit word Tada, which means mountain, and Asana, which means seat or posture. It serves as the blueprint and starting point of all the other standing poses. For doing this, stand on your big toes, touching and heel slightly apart. Then lift and spread your toes. Lift your arms above your head and stretch. Hold this pose for 30 to 60 seconds while taking slow, deep and steady breath. Okay, relax. Now the next pose is Vrikshasana or the tree pose. It is a classic standing yoga pose where you balance on your one leg while placing the opposite foot against the inner thigh or calf of the standing leg. With arms extended overhead, it symbolizes balance, stability and grounded strength. For doing this, stand erect, shift your body weight onto the right foot, bend your left knee and use your hand to lift your left foot. Place the sole of the left foot flat against the right inner thigh. Once stable, bring your hand to the center of your chest and join your palms in Anjali Mudra. Inhale deeply, slowly extend your arms slightly over. Maintain this pose for 20 to 30 seconds. Relax. The next yoga pose is Vajrasana, also known as Thunderbolt or Diamond pose. It is a simple kneeling yogasana. The word comes from the Sanskrit word Vajra, which means thunderbolt or diamond, symbolizing strength, and asana means posture. It is unique as it is the only yoga pose recommended immediately after eating. For doing this, kneel on the yoga mat. Bring your knees and ankles together. Exhale slowly and sit back on your buttocks, resting on the inner heels and thighs on your calf muscles. Rest your hands on the thighs, palms facing downward. Practice deep breathing. Maintain this for 30 to 30 seconds to 2 minutes. Relax. Now the next yoga pose is Balasana. Balasana is translated as child's pose in English. It is a fundamental restorative yoga posture that resembles a resting child or a fetus position. The name comes from the Sanskrit word Bala, which means child, and Asana, which means pose. For doing this, kneel on the floor, sit on your knees, exhale and slowly fold your torso forward, draping your belly and chest between the thighs. Bring your arms forward. Hold on to this pose for 30 seconds. Relax. The next yoga pose is Makarasana, commonly known as the crocodile pose in English. It is a restorative prone yoga pose designed for deep relaxation and stress relief. For doing this, you have to lie flat on your stomach, with your legs straight behind you. Bring your hands in front of you, bend your elbows and rest your chin in the palms.
Aha.
Close your eyes and breathe deeply belly. Hold this pose for 2 to 15 minutes. Relax. The next yoga pose is Dandasana. It is a foundational seated yoga posture, in English also known as staff pose or the stick pose. For doing this, sit on the floor, extend your legs and sit firmly on your sit bone. Put your palms flat on the mat besides your hips with fingers forward. Hold and breathe for 20 to 30 seconds. Relax. The next yoga pose is Virabhadrasana, commonly known as the warrior pose. It's a group of standing lunging yogasanas named after a fierce mythical warrior in Hindu mythology. In English, it symbolizes spiritual warrior overcoming ego and ignorance while physically building strength, balance, and flexibility. For doing this, stand straight. Step on your left foot back about 3 to 4 feet. Bend your right foot at a 90-degree angle, ensuring your knee stays directly on the angle. Raise your arms overhead, palms facing each other. Hold for 5 to 8 minutes. Relax. So that's all. These yoga poses we can do in day-to-day activity, day-to-day life, so that we can reduce our stress and maintain our health. Thank you.
Already are gathered here. Did everyone understand the theory section? Yes. Now we are entering into the questioning section. Now I am going to ask you some of the questions. If you know the answer, be free, stand up and respond to the question. Because with your participation, we can make the session more interactive and productive. So let's start the session. Question number 1. Who is the father of modern yoga? Anyone stand up and answer? What are the 3 dimensions of yoga? Name the main stress hormone in our body. What is our brain's natural anti-anxiety chemical? What are the benefits of doing yoga? Muscle relaxation, mind relaxation, helps us to feel. Thank you all for your participation. Now let us discuss one small thing. What is the best time for doing the yoga? Anyone know what is the best time for doing yoga? Yes, early morning is the best time. Why it is the best time? Because in the early morning the sun will rise. It is a strong environment. Our stomach will be empty, so we can able to do the poses freely. So it is one of the best time. Another one discussion question. If we get some of the complication while doing yoga, is it possible? Yes, it is possible. Because while doing yoga in the pregnancy period, there is a chance of getting complications. So we need to do the yoga only by the physician consultation. Next thing, we need to monitor that our body condition is it is healthy or not. So these are the main things we need to monitor before doing the yoga. Next, how many minutes we can able to do the yoga? For beginners, at least 15 to 20 minutes is enough. If you are well in yoga, so you can able to do the yoga up to 60 to 90 minutes. So thank you everyone for all your participation.
These sections are very useful for us, and we all enjoyed very well. And each and every section helped to gain more knowledge about the importance of yoga and the importance of healthy life. And the instructors provide great guidance and support. And thank you all.